Hi, I'm Dr. Athre with Athré Facial Aesthetics in Houston, Texas. The purpose of today's talk is to discuss cartilage grafting and rhinoplasty. I'm sure if you've done any research on rhinoplasty, you've heard the terms cartilage, cartilage grafting, cartilage donor site, spreader graft, columellar strut. These are all various terms that are used with respect to cartilage grafting. So what is cartilage grafting? The way I explain this to my patients is as follows. The nose is kind of like a tent. It's created by a structure much less a tent would be. That structure is created by cartilage. There are 5 cartilaginous structures that create the structure of the nose. The first and most important cartilaginous structure is this middle piece called the septum. That septum acts kind of like the major tent pole of the nose. The other cartilaginous structures that determine the shape and structure of the nose include a pair of lower lateral cartilages, which form the tip complex, and a pair of upper lateral cartilage, which forms the cartilaginous mid-vault of the nose. These 5 structures primarily determine the shape and structure of the nose. We use different types of cartilaginous grafting in order to increase tip definition, increase projection, change rotation, and sometimes add structure to the nose to prevent things like collapse and twisting. One of the major reasons why revision rhinoplasty is much harder than primary rhinoplasty is because of the fact that there is most likely some amount of cartilage that was removed during the primary rhinoplasty, which allows for less amount of cartilage to be utilized for grafting and less cartilage that's actually in the nose to provide support for the nose. As such, we therefore have to remove cartilage from other places in the body in order to add structure. Some of the most common areas that we borrow cartilage from are the ears, as well as the rib. One of the other options actually is using cadaveric rib cartilage, which is rib cartilage that has been irradiated and is originally from cadavers. Each one of these types of cartilaginous grafting materials has its inherent advantages as well as disadvantages. For example, ear cartilage is excellent for contouring and providing support, for example, the lateral ala. However, is not rigid enough to truly add support to the nose. Septal cartilage, which is the cartilage from the inside of the nose, is the ideal type of cartilage which can be pretty much used for everything. Now, rib cartilage, for example, is extremely strong and extremely rigid. However, its disadvantage is that it has a tendency to warp over time since ribs are normally curved. Lastly, cadaveric rib cartilage has the advantages of being abundant, being readily available, and easily accessible without an additional incision on the body. However, cadaveric rib cartilage has the disadvantage that it resorbs over time, and hence this can be a problem in doing a rhinoplasty in a young patient. This is a quick, brief primer on cartilaginous cartilage grafting in rhinoplasty. If you have any questions about this video or any of the other videos that you see here, please don't hesitate to give us a call. Athré Facial Aesthetics, Houston, Texas, www.athrefacialplastics.com.